Hello and welcome. In this video, we'll look at celiac disease, an autoimmune disorder that affects people who consume gluten, a protein found in wheat, barley, and rye. In celiac disease, even tiny amounts of gluten can cause an immune response, resulting in small intestine damage and a variety of distressing symptoms. These symptoms can range from digestive problems like bloating, diarrhea, and abdominal pain to non-gastrointestinal issues like fatigue, joint pain, and skin rashes. Untreated celiac disease can have serious long-term health consequences. Celiac disease is estimated to affect 1% of the global population. It's not just about avoiding obvious gluten sources like bread and pasta. Gluten can be found in a wide range of foods, condiments, beverages, processed goods, medications, personal care products, and even non-food items. Our goal in this video is to uncover these hidden sources of gluten and equip you with the knowledge you need to navigate the challenges of finding hidden gluten in your daily life. Let's look at 7 less-known items that may contain gluten. First, cosmetics and personal care items. Gluten may be present in many of these products, including lip balm, toothpaste, makeup, and even soap. Gluten is not harmful to your skin, but it can cause a reaction if you ingest it, which can happen accidentally with products used around your mouth or hands. To avoid gluten, look for terms like wheat germ, barley extract, malt extract, oat extract, or similar terms you see on the screen. Dextrin is another term for starch, and while it is commonly made from corn, it can also be derived from wheat. Though most vitamin E comes from corn or soy, it can also come from wheat, in which case it contains gluten. Second, vitamins and medications. Gluten is frequently used as a filler or binder in prescription and over-the-counter medications, as well as vitamin and mineral supplements. A binder or filler is an inactive substance that aids in the retention of the active ingredients in a pill. Gluten is just one of many potential ingredients that manufacturers could use for this purpose. Medicine labels, unfortunately, are not as clear as food labels. Unless they are made from corn, terms like starch or natural flavors may indicate the presence of gluten. Barley malt can sometimes be used to make additives such as caramel coloring. Natural and artificial flavorings may include barley-derived ingredients. If you notice these or other ambiguous ingredients on a medicine or vitamin label, contact the manufacturer for clarification. Third, craft supplies, particularly those aimed at children, can occasionally contain gluten. This is due to the fact that wheat-based ingredients, such as wheat flour or wheat paste, can be used as low-cost, non-toxic binders in these products. Wheat flour may be present in some Play-Doh. In terms of skin contact, this is usually not a problem, but it can be dangerous if a child puts their hands in their mouth after playing with the dough or accidentally ingests some of it. Some glues, particularly paste-style glues, may contain wheat-based ingredients. Keep an eye out for finger paint, as some contain wheat-based ingredients. As an alternative, you can make safe gluten-free versions at home for craft supplies like Play-Doh and glue. It is critical that children thoroughly wash their hands after using craft supplies, especially before eating. This will help reduce the risk of gluten residue ingestion. Fourth, even trace amounts of gluten in cross-contamination can cause symptoms in people with celiac disease or severe gluten intolerance. This means that kitchen utensils and equipment used with gluten-containing foods may be dangerous. Cross-contamination can happen in both home and restaurant kitchens. Because of the volume of food being prepared and the shared use of equipment and space in restaurants, avoiding gluten cross-contamination can be even more difficult. A gluten-free certification program exists to ensure that restaurants adhere to strict guidelines to prevent cross-contamination. This includes training staff, using separate cooking and prep areas, and having separate, dedicated gluten-free tools and appliances. If you're following a gluten-free diet, don't be afraid to ask about the restaurant's cross-contamination practices when dining out. Thorough cleaning, as well as having dedicated gluten-free utensils and appliances, can help to maintain a safe, gluten-free kitchen environment at home. Fifth, Shampoo and conditioner are simply part of most people's daily routines and are not given much thought. Wheat protein or hydrolyzed wheat protein, barley extract, and oats are all ingredients in some shampoos, conditioners, and other hair products. These ingredients can help to strengthen and thicken hair, as well as moisturize and shine it. They do, however, contain gluten, which can be problematic for people with celiac disease. While we don't usually eat shampoo or conditioner, they can easily come into contact with our mouths while we're washing. This is especially dangerous for young children who may inadvertently swallow bath water or put their hands in their mouths. Although research on this topic is limited, people with dermatitis herpetiformis, a skin manifestation of celiac disease, may have a skin reaction to gluten-containing products. Individuals with celiac disease should look for gluten-free hair products if they want to avoid all potential sources of gluten. Sixth, tea is typically gluten-free in its pure form, making it a safe choice for those with celiac disease. The leaves of the Camellia sinensis plant used to make these teas, whether black, green, white, or oolong, are naturally gluten-free. Problems may arise, however, when additional ingredients are added to the tea or during the manufacturing process. Be cautious with flavored teas. Some manufacturers use gluten-containing flavorings or grains like barley as part of the flavor profile. This is more common in teas that advertise a malty or bready flavor, such as certain dessert teas. Some companies use wheat paste to seal their tea bags. While the amount of gluten in your cup of tea is likely to be small, those with celiac disease who are particularly sensitive should avoid it. Maltodextrin and other additives derived from wheat may also be present in instant tea powders, while maltodextrin derived from corn is safe. Finally, latex or rubber gloves act as a barrier between you and germs and other contaminants. Certain gloves, however, can be an unexpected source of gluten exposure for those with celiac disease. Powdering some latex or rubber gloves makes them easier to put on and take off. The powder, which is frequently a form of starch, aids in moisture absorption. However, this is where problems could arise. Some glove manufacturers may use gluten-containing wheat starch or oat powder for this purpose. Non-powdered or powder-free gloves are a better option for people who have celiac disease. There is no powder in these gloves that could potentially contain gluten. It's critical to read the product descriptions or contact the manufacturer to confirm whether their gloves are suitable for people who are gluten intolerant. Remember that the likelihood of a significant reaction to powdered gloves is low unless there is direct and frequent contact. Navigating a gluten-free life with celiac disease is more than just changing your diet. It's about changing your entire lifestyle, being aware of the products you use every day, and always remaining vigilant. When in doubt, always contact the manufacturer for more information about their products. If your loved one is affected by celiac disease or another autoimmune condition, please share your experience in the comments. As always, if you found this information useful, please like, share, subscribe, and turn on the notification bell. Thank you for watching, and I'll see you in the next one.